Miss Jones. How are you today?
Good. How are you?
I'm good. My name's Tracy, and I'm a nurse, and I'm going to be doing your physical assessment today. I would like to just make sure that you understand that during your physical assessment today, we will be recording you on video and want to get your consent that that will be okay.
That is fine.
Okay. Well, I'm going to go wash my hands, and then I'll be right back, okay? And we'll get started. Okay, we're all ready, and I've already got my stethoscope all cleaned up, so we're going to start with your height and weight. So if I'll just have you step over here, we'll go ahead and get your weight. Give it 1 second to get reset. All right, step on up for me. Okay, that looks great. Just go ahead and step back. And then we're just going to have you come over here, and I'm going to get your height. Okay. So step right back up. All right, we got that. Go ahead and have a seat back down, and we'll get your blood pressure. Right. That looks great. It was 100 over 55. So we'll take this off. And now I'm going to check your pulse rate. Pulse rate is 70, so that looks great. Now we're going to check your temperature. All right, 97.9, that looks fine. Alright, and now if you'll just breathe normally, I'm going to count your respirations. Looks like you're at 20, so that's perfect. If you'll just go ahead and you'll lay back for me. Okay. Just put your feet up and sit up in the bed, and I'm going to take a listen to your lungs before you lay back there. Deep breath, one. Another. Another. Again. And again. And again. Now we're just going to listen from the front. Okay. Another breath. right, that looks really good. Now I'm just going to tap on your back so I don't have to have you sit up again later just to check on your kidneys. Okay. Did you feel any pain when I did that?
No.
Okay. And then we're going to do that again over here. What about now?
No.
Okay. All right. So we're going to actually stay sitting up for me just for another second. We're going to just check your cranial nerves with a few little tests. So we're just going to check your pupils first, and then I'll ask you to do some other things, okay?
Okay.
All right. Can you shrug your shoulders? All right, perfect. Can you raise your eyebrows? All right. Can you smile for me? Okay. And what about, let's check your grips.
Okay.
So just squeeze my fingers as hard as you can. Squeeze, 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 squeeze. Perfect. That was perfect. Next, we're just going to ask you a couple questions, and they may seem silly to you, but they tell us things. So tell me what today's date is.
Today is April 24th, 2015.
Okay. And who is the president right now?
Obama.
Okay. And then tell me where you are.
I am at the hospital.
Okay, perfect. So next, I'm just going to feel some pulses, okay? So I'm going to feel your wrist here. And then I'm going to feel your neck. And then I'm just going to feel down here at your feet. Excellent. Those all feel great. So then the next thing we're going to do is we are going to listen to your heart, okay? Actually, I'm going to lift your gown up just a little bit, okay? Sounds good. So, do you take any medicines, Miss Jones?
I only take a prenatal vitamin.
Okay, so that tells us you're pregnant, and we're fixing to get into our abdominal assessment, so we'll keep that in mind as we get there. We're really going to focus on your abdomen today in our assessment. So there are several questions that I just want to go back over. I know we've done your history prior. So as far as appetite, have you had any appetite changes?
Just some nausea.
Okay. So are you using any medicines at all to treat that?
No.
Okay. So are you normally more nauseated in the morning or in the evening, or is it an all-day thing?
It's normally an all-day thing.
Oh, it will pass, you know. So, but I'm glad that, you know. Are you getting enough nutrition in? Do you feel, even though you're nauseous?
Yeah. I try to eat small meals throughout the day.
Okay. All right. What about any swallowing issues? Do you have any problems swallowing at all?
No.
Okay. And then what about, is there any foods that make you more nauseous, or is there any foods on a normal basis before pregnancy that you had trouble eating or have any trouble with?
No.
Okay. The next thing I want to ask you about is your bowel movements. Do you go daily? What's your normal routine?
I've never been on a daily regimen, but
Okay.
Every couple of days, yes.
Okay. So that's normal for you. And are they of normal consistency? And you know, how are they formed? Do you have diarrhea at all?
No, everything is formed fine.
Normal. Okay. All right. And then, have you noticed any color changes in those? I mean, you never noticed any blood or?
No.
Okay. All right. Then that all sounds fine. So we're going to move on to just inspecting your abdomen, okay? The first thing I'm going to do is just take a little look at it and make sure everything looks okay. So I'm just going to kind of go around the bed and take a peek. So I'm just going to pull your gown up so we can see it really good. Okay. And I'm going to put your head down just a little bit, okay? Makes it a little easier for me to see it when we're flat. All right. So I'm going to take a little look here. And I I want you to take just a deep breath for me. Okay. So everything looks fine there. Next thing we're going to do is just take a little listen, okay? And my stethoscope seems to be warm, and I think my hands are, okay? So that, everything sounds fine there. So the next thing we're going to do is I'm just going to listen to, for any other kind of extra, like vascular sounds or anything that may be present. That all sounds fine. So the next thing we're going to do is we're going to check your liver and just try to get a measurement on that. So I'm just going to palpate your belly.
Okay.
And then I'm going to palpate a little bit deeper, so you'll feel me pressing a little bit harder, okay? All right. So everything looks fine with that. No problem there. So now I'm just going to take a little listen by tapping on you. Well, I'm tapping on you just a little bit, okay? Sounds fine. And now, like I said, we're going to try to locate your liver there, okay? Alright, so we're just going to mark that. And then I'm going to tap a little higher up here. Alright. And then we're just going to measure this, okay? Alright. That looks fine, okay? The other thing we're going to do is we're going to try to check for your, or see if we can feel your liver, okay? So I'm just going to put my hand up behind your back here, okay? And I'm going to press on you just a little bit. You let me know if I hurt you. Can you cough for me? Okay, that's perfect. And then also we're going to do the same thing, about the same thing on your side, just to check your spleen, okay? Okay. Take a deep breath for me. All right, now let it out. Perfect. All right. And then we're just going to check your kidney over here. Okay. So I will mash just a little bit over here. All right, and take a deep breath for me. And let it out. Perfect. And then we're going to do the same thing over here to check this kidney. Okay. Okay, take a deep breath and let it out again. And let it out. Perfect. All right. And then we're just going to check to see if we can feel your aorta here. Okay. All right. That looks good there. So now we're just going to take a quick look for any kind of skin issues. It looks like your arms look good. And then roll over and let me take a peek at your back. Okay. And that looks fine. And just take a peek at your legs. Doesn't look like you have any swelling. Do you have any problems with swelling or edema in your legs at all? No. Okay. And then just a couple questions about your urinary system. Do you have any problems voiding? No. Okay. And what about, do you have any stress incontinence or anything? This is your first pregnancy, so no. Okay. All right. And then, what about blood in your urine? Have you never noticed any blood in your urine? No. Okay. Now, as far as we know, you're pregnant. So, what about your period? Was it regular before you got pregnant?
Yeah, it was regular.
Okay. All right. And you do see your GYN physician.
Yes.
When was your last appointment?
Yesterday.
Okay, perfect. So you're following up with your prenatal care. And then what about monthly self-breast exams? Do you do those?
Yes.
Okay. Are you confident in doing those?
Pretty confident.
Okay. Well, we can certainly get you some information and send it home just as a refresher to make sure you are performing those correctly. And you know the best place to do those are in the shower. Is there any questions that you have for me?
No questions.
Okay. My suggestions to you is to, just keep following up with your GYN physician, and, if you don't have any other questions, then you would really look like you're in good condition. Thank you so much for allowing me to do your physical assessment today. Thank you.